everyone, I'm Dr. Z and you're watching Dr. Z PhD, the place to be for expert info on gender. There's a lot of talk about how similar studying HRT is to puberty. Some even call it going through second puberty, while others strongly disagree with this analogy, even feeling as if equating it to puberty is infantilizing to the current adult status. The question still remains, is it not analogous or similar to puberty? And should we really be calling it just that? And that's exactly what I'll try to explore in this video, and I'll share you my own thoughts on equating puberty to HRT. And remember, if you don't want to miss any info like this from me, make sure to subscribe to the channel. Now let's discuss puberty. A time in our life we can all remember with either pleasant or painful memories, or maybe a mixture of both. Let's take a moment here and define puberty for starters. Now, puberty generally is defined as a time when a boy or a girl becomes sexually mature. Now, what exactly does sexual maturity mean? Does it mean one can engage in sexual behavior, sexual intercourse, for example? Or does it mean one's sex, as in biological sex, matures and becomes an adult? Well, what puberty really is a process of physical changes through which a child's body matures into an adult body capable of sexual reproduction. So we can sum it up by saying that puberty is a time when our brain sends a signal to our gonads, testes in boys and ovaries in girls. In response to the signal, testes or ovaries start producing hormones. And these hormones in turn stimulate libido, known as sexual function, as well as growth function of overall physical body. So some changes do take place, such as your bones, your muscles, your skin, your hair, your breasts and your genitals, your height, your weight, and so on, do physically change during puberty. So as we can see, puberty is an important process in our maturation, as it not only starts sexual maturity, but also spurs growth. I know that for trans people, puberty was a very painful period, as it jump-started your body in the secondary sex characteristics you didn't identify with. And I'm really sorry you had to go through that. If you also recall from your time in puberty, not only did your body and sexual drive change, but you were also emotionally affected. These emotional changes were due to hormones being introduced into your body, which may have caused mood swings, anxiety, depression, temper tantrums, and anger, just to name some of the emotions due to puberty. All of this happens as we try to adjust to hormones we have never really felt, as well as the age when it happened. Because remember, puberty really happens around the age 10 to 13. And can you remember yourself at that age? Well, most likely you were going through a time of trying to fit in with others, trying to fit in with your peers. That's an age when we really start to realize our sense of autonomy, our sense of who we are. When we feel really misunderstood by our parents as well as the world. Now, top all of that with a dose of hormones which puberty brings, which you get as a teenager who's ready to explode, especially since the brain hasn't really fully developed to make rational, logical decisions about what's really happening. And that's puberty for you in a nutshell. So now let's talk about what happens when a sexually mature adult who has gone through puberty as a teenager introduces a new hormone into their body, say estrogen or testosterone, for example. A hormone that a person is not even closely familiar with or has any idea how it will make them feel or think. Now, no wonder so many trans people equate HRT to second puberty. But is it really a second puberty that you're experiencing? Let's just take a moment here and to think about it, okay? So we have an adult body that suddenly goes on feminizing or masculizing hormones. Now, these hormones alter secondary sex characteristics, but not fully, because your body has already gone through that maturity. But yet, changes still happen. So, for example, in trans women, they may experience breast development, softer skin, less acne, redistribution of body fat, and reduction in muscle mass. They will also experience decrease in sexual desire, decrease in erectile function, and shrinkage in testes. Just to name a few changes on estrogen, right? Whereas in trans men, they may experience increase in hair growth, steepening of their voice, acne, increased muscle mass, increased appetite, as well as weight gain. They'll also experience increased sex drive and increased growth of clitoris on testosterone. Now, I want you to notice that while there are many changes that do happen during HRT that are similar to puberty, there are also many changes that are not similar to puberty, because you have already gone through sexual and physical maturation period when you were a teenager. And while many changes feel similar to you, they're not exactly the same. In addition, when you start HRT, there are many emotional changes introduced into your life that you never really experienced before. Now, the difference here is that you cope with them as an adult versus a teenager. But does that mean you're really, really experiencing puberty? Now, to be honest, I don't really think that you are experiencing puberty. Not in a literal sense, at least. What I do think is that you're going through a very important set of changes as an adult with adult body in shifting the hormone chemistry of your body. And many of these changes are similar to puberty, and therefore they may feel like one. And yet what you're going through is a completely different experience that warrants its own attention. And not recognizing it as a separate important experience is really doing disservice to you, in my opinion. People need to recognize that going through emotional and physical changes associated with HRT as an adult is very, very different. You have jobs to keep, relationships to sustain, and responsibilities to attend to. And when you add HRT to your adult life, things can become quickly unstable, or at least it can feel that way. It may make it difficult for you to go to work when you feel very emotional on HRT. You may struggle to attend to your responsibilities. As you can see, adulthood carries consequences, right? Versus a teenager, many responsibilities are not present. And there are not many consequences for going through puberty. I mean, not really. In fact, you're given a pass if you kind of throw a tantrum as a teenager, because guess what? Somebody will say you're just going through puberty. Now, do you think your boss will approach your transition with the same attitude? Probably not. As you can see, we need to find a properly appropriate terminology to help us characterize these very, very important changes that we go through as adults. Because while many of them are similar to puberty, one fundamental fact again remain, and that is you are not a teenager, you're an adult. And as such, your body, your sexual organs, and your brain are fully developed. In addition, you have had some life experiences as an adult, which all help you make important decisions which teenagers are really not capable of. So when we say trans people go through puberty when they transition, we're really giving public a wrong idea. Because the public automatically thinks of what really entails and imagines a trans person behave like a 12 or 11-year-old. Even worse, the public equates puberty to immaturity, and that's very, very inaccurate. In fact, in my experience, trans people are some of the most mature individuals I have ever met, because you all have to make decisions about life-altering things such as life transition. So saying that an adult goes through puberty can feel infantilizing, and I can understand that. Not to mention, it paints a portrait of trans people as emotionally unstable human beings. Now, no wonder many of you commented on my Facebook post and expressed a strong disdain describing your experiences as going through second puberty. So I think a new way of looking at HRT experience is in order. A way to describe it where we can respect physical and psychological changes it puts us through with all the dignity and respect that it goes and deserves. But one that doesn't really equate us to teens and paints picture of incapable adults. It is important to properly recognize and acknowledge these experiences in your life other than comparing them to teenage experience. Because words are very, very powerful and they help us understand and define meaning. And as long as we call HRT experiences puberty, we're not opening any doors for researchers or anybody else to study our experience and to document them for others to follow. To document how HRT really affects you as an adult on a daily basis, especially adult living. We're also creating an inaccurate meaning of what we're going through, which is while in many ways similar to puberty, it's also very different. Now, I don't know what the right description should be. Maybe calling it maturation into your true self is a better way to describe it. Because what you're going through is very important and should not be disregarded, belittled, or dismissed. It needs to be properly acknowledged as an adult going through a very personal and important physical as well as psychological changes and experiences. Now, this way clinicians such as myself, for example, and medical providers can better educate and help people understanding their experiences. Now, what are your thoughts on this? I mean, what do you think about what I just mentioned in terms of, puberty being similar and yet not being very similar to adulthood? And if you agree with me, if you disagree with me on that we really need to find a new word to describe and to define this experience, because I do think that in a way we're doing ourselves disservice because it's a completely different experience, but it's also such a fundamentally important experience in your lives that really, really needs to be acknowledged and respected and recognized as such. So I really encourage all of you to comment below. I'd love to hear what your thoughts are on this matter, whether you agree with me or disagree. All of it is fine. I'd love to continue discussion on this topic, whether we should keep this idea of HRT transition as a second puberty or whether we should really find a way to define it that matches our developmental experience in our developmental kind of like lifespan, life path. So please comment below, and if you're new to the channel, consider subscribing, and I look forward to seeing you all next Friday. Bye.